Well, good afternoon and welcome to Waco City Hall. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'm going to be the moderator for our weekly press conference that thankfully you are joining, and we get great information from the panel we have here. Give you a real quick outline what we're going to do, and then I'll introduce you to our panel. Each of our panelists will be given an opportunity to make some opening comments, and then we will go to their questions we received. But before we get going off that, I want to make sure that everybody knows that downstairs in our studio on our first floor, we are doing an American Sign Language translation for those persons who need those services. And we also have a Spanish interpreter laying down a separate Spanish audio track that we will put on top of the video of this when it's concluded. And at 4:30 this afternoon, we will replay that for our Spanish-speaking audience. And here today to help introduce that and read the Spanish interpretation and an invitation is our City Secretary, Esmeralda Hudson. Esmeralda? You're muted.
You would think. Thank you, Larry. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esa conferencia de prensa. Esa grabación completa en español reemplazará el sonido de inglés en la video y una versión en español de todas las conferencias de prensa se reproducirá en el canal de cable de la ciudad de Waco, aproximadamente a las 4:30 de la tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv.
Thank you, Esmeralda. Thank you so much, and have a good Thanksgiving. Okay, we're doing this completely virtually again, and in the room with me now is only Julia Vera from the City Secretary's office, who's handling the Zoom meeting. But joining us by remote Zoom are our four panelists, and we're so welcoming for the second time now our new Mayor, Dylan Meek. We will also be hearing from McLean County Judge Scott Felton, Dr. Jackson Griggs from CEO of Family Health Center, Dr. Brian Becker, Chief Medical Officer for Ascension Providence, and Dr. Mark Eliason from Baylor Scott & White. Gentlemen, thank you again for taking time right here before Thanksgiving, but I know you all have some very, very important messages. We're going to start off with opening comments, like I said, from each of you, and then we'll go to the questions. We have about a dozen or so questions, and then we have two people registered from our media that will be on the line for a couple of questions each, and then we'll let the mayor wrap up with a closing comment. Hopefully we'll do that within an hour. So hopefully everybody will stay tuned. We've got some great information. We're going to start off with our opening comments. We'll go in the order of Dr. Griggs first, Dr. Eliason, then Dr. Becker, then Judge Felton, and then our mayor. So let's start off with you, Dr. Jackson Griggs from the Family Health Center.
Thank you, Larry, and thank you, Judge and Mayor, for inviting me back. We'll start with our numbers and then share some slides. Worldwide, the Johns Hopkins Coronavirus Resource Center reports that we have crossed the 60 million case threshold today. So we have seen now globally just over 60 million cases of the novel coronavirus. And there have been just over 1.4 million deaths worldwide due to this virus. In the United States, we've seen a cumulative total of 12.6 million coronavirus cases and 260,000 deaths due to COVID-19. In our state, and this is per the Department of State Health Services dashboard, we have seen 1.1 million cases and 20,750 fatalities. I'll share with you McLennan County numbers. This is an update as of this afternoon. We have a total number of confirmed cases of 14,029. Just about 10% of those are active at 1,408 current active cases. As of this afternoon, the Public Health District has received notification of 212 new cases of coronavirus. We currently have 94 people hospitalized with COVID-19, and 16 of those patients currently hospitalized are requiring ventilator support. We have 3 additional deaths to report and that brings the total deaths in McLennan County due to COVID-19 to 185 deaths. Among the community-wide surge testing, the total tests to date are 27,744 performed. The positivity rate among the surge testing is 9.5%. Within elder care facilities, McLennan County currently has 17 facility outbreaks. There are 76 active cases among patients and staff in these facilities, and to date, 72 fatalities have occurred in or associated with nursing homes. The county jail, there are 2 active cases. There are 3 church clusters that have been identified within McLennan County, and the health district is working alongside and helping those churches. And schools are currently closed, so we don't have any new data to report on independent school districts or private schools. I'm going to shift now to share some slides that I've prepared for you today. So as I've shared previously, this graph depicts the new cases per day per 100,000 in population. And this blue line is the United States numbers. So we are at 52 new cases per day per 100,000 in population, and this is a 7-day rolling average. Texas is depicted in the orange line, and Texas has 38 new cases per day per 100,000 in population. And we have 73 new cases for McLennan County. So what you see here is community spread, 1 to 10 cases, accelerated spread in the 10 to 25 cases, and that tipping point at 25 here, where we have far surpassed that tipping point and continue to see that exponential spread. The positivity rate in McLennan County is now 14%, and that exceeds the positivity rate at the state level of 12%. And I would just again make mention that this is in addition to the fact that we are in the midst of our surge testing. So this reflects that while our surge testing has helped a great deal, it's not keeping pace with the increase in new cases that are occurring across the county. As a reminder, mitigation or slowing of the infection occurs under 10%, and suppression occurs under 3% with testing and inadequate contact tracing. This is a new bar graph that I haven't shared before, and this just is a snapshot. So this only depicts today's numbers, and so this is one point in time. And what this shares is the current hospitalizations per 100,000 population. So again, we use that denominator of 100,000 so that we can compare huge groups of people and then local communities by making the ratio of a fixed number of population. And in this case, we're using 100,000 in population. So the current hospitalizations per 100,000 population for the United States is 27, the state of Texas 29, and for McLennan County is 37. So you see that in terms of the hospitalization, current hospitalizations are quite a bit higher in the county than the proportion of population in the United States. Our effective reproduction rate remains above 1. So every individual who has the coronavirus spreads it to at least one other individual on average. and this is also new, but I thought it was a relevant graphic to share with you. This is from the UT Health, the School of Public Health that's in Houston, and this is data that's from Google when individuals allow their Google location history to remain available to Google. They can track where individuals have been and patterns. They anonymize this data and then aggregate it and share it. So the School of Public Health is using this to track behavior trends. And what you see here is at the very top graphic, the bar graph that's across the top that indicates residential time spent in homes. What you see is that compared to the baseline, which was before February, we are in homes in our places of residence about 7% more than the baseline before the pandemic began. We're in workplaces currently we're less frequently in our workplaces by about 23% compared with the baseline before the pandemic. We're in grocery stores and pharmacies less by about 4%. We're using public transportation less by about 7%. And this last category of retail and recreational, these are restaurants, bars, shopping malls, and we're in those locations less than baseline by about 14%. I thought I would take the two key bar graphs here and plot it. If I can get my slides to cooperate. Plot it alongside the incidence graph so that we can look at as we see new cases in the community, what are our collective behaviors represented by Google's tracking mechanism? What are our collective behaviors doing? And what you see here in June and July, as we had that initial peak, you see that in recreation retail, so again, restaurants, shopping malls, bars, there was a lot less time spent in those areas. And then you see a little bit of a return towards baseline. But what you don't see is here more recently, when we've had this great big peak, what you haven't seen is a lot of change in behavior. You haven't seen less frequent visitation to malls and restaurants and bars. Again, I don't know that this data is perfect. It's sort of the best that I know of in real time to measure our collective community's behavior. And what I'm concerned about is that while numbers are climbing rapidly, we're not seeing a commensurate decrease in visitation to these areas that are areas that pose the greatest risk of spreading the coronavirus. Similarly, in residential settings, my hope would be that we would see a big climb in the time spent at home as opposed to out and about. But you see that's also a pretty flat line. Even as we've seen this exponential climb in our number of cases, we've not seen commensurate growth in the amount of time spent in residential locations or time spent at home. Again, I don't know this is perfect data, but it's what we have available to us, and it does concern me. So what can be done? Remember that anytime you lower your mask around someone who isn't a household member, you risk your own health and the health of the community. So important that we keep our masks on when we're not with our household members. We should stay at home as much as possible until this surge subsides. We should remember that dining and drinking in is high-risk behavior. In other words, I'm not describing pickup or drive through, but being inside a restaurant, inside a bar is just really risky right now. And then the last thing that we can do is adjust our plans. Holidays this year pose a unique risk. And so to just reinforce what I shared last week, please enjoy the holidays with only your household. Join others virtually and not in person. This would be my strong recommendation. And as I shared last week, if you must get together in person with non-household members, invite as few as you're willing to invite. So smaller is safer. Set up tables outside, spread the tables apart. In other words, don't have Thanksgiving dinner inside. Keep the chairs at the tables at least 6 feet apart. Ask a leader, someone who has the respect of the group and a voice of authority, to make an announcement about what the behavior expectations are. I know this is awkward, but it's so valuable to say, hey, here's what we're kind of expecting of each other while we sit down and have our time together. Ask that person to be the enforcer to keep everyone safe. Provide masks. Don't unmask till it's time to eat. Remask after meals. And for their own safety, prohibit those who are health vulnerable from joining the group. Have hand sanitizer available at every table. And ask guests not to attend if they have any cold symptoms, fever, cough, shortness of breath, body aches, chills, or other viral symptoms. And then lastly, in the interest of the community, I've added this last bullet point today. If you do hold an event, consider testing 3 to 5 days after involvement in the event, so that if there is an exposure, it can be, and if individuals do contract the virus, it can be identified quickly, and contact tracing isolation can be put in place. My final slide is from University of Pittsburgh. It's just some clarification, because I think there's a misunderstanding in the community that if I test now, then I'm safe to be a part of a group or to invite a group over. This slide, in a kind of graphic way, I think explains how that's just not the case. It uses an individual named Casey. Casey was exposed to COVID-19 on day 1. On day 5, Casey felt well and tested negative for COVID-19. Casey was interested in going to a Thanksgiving group, so Casey went and got a test, and it was negative. So they thought they were safe. Casey enjoyed, on day 8, Casey enjoyed Thanksgiving with 17 family members while contagious. And this is just a point of clarification that a negative test does not mean that you don't have the virus, particularly when you're asymptomatic and it's early. There can be just a little bit of circulating virus that hasn't replicated and really taken over. And so you can get a negative test that's a false negative when you have just contracted the disease or you're really early in your course. Casey enjoyed Thanksgiving with 17 family members while contagious. And then on day 10, that's when Casey developed symptoms and tested positive for COVID-19. So don't be like Casey this holiday season. That's my last slide.
Okay, great information, great information. Let's go to Dr. Mark Eliason with Baylor Scott & White Hillcrest. Dr. Eliason?
Good afternoon and happy Thanksgiving, everyone. Just remember, as we are approaching this holiday season, you're going to be around people that you haven't been around. And as Dr. Griggs clearly demonstrated, there is significant risk as you're around people who are not part of your core family. There is certainly mask fatigue in the community. I was at the grocery store yesterday, and while there were a lot of people there and it was very crowded, I counted at least 6 people who had no mask on whatsoever, not to mention the countless people who had it kind of dipped just below the nose or even under the chin. It's still an issue, and it frightens me. Someone recently asked me, we've been talking about masks and using masks and social distancing, and when are people going to finally get it? What can be said? And my answer is I have no idea. We've said it. We've tried to be clear. We've tried to be helpful. Governor has even made a state mandate that we're to wear masks and to restrict some of our activities. but it's still just not, we're still not there as a community. And consequently, we're having a huge surge and people are getting sick and some people are dying. I think of it much like brushing your teeth. You know, as parents, we tell our kids to brush their teeth, we teach them, we remind them, we reinforce it. It's really up to each individual to take that responsibility, whether it's brushing your teeth or wearing a seatbelt. It's smart. It just makes sense. Please do it. A very dear friend of mine recently contracted COVID, and it was only after she was hospitalized that she confided in me that she was distraught because now that she's in the hospital, she can't host 18 people for Thanksgiving. Not that she had COVID, but now she's in the hospital. So please, if you're sick, do not host Thanksgiving. Do it virtually. Do it later when you're not sick. There was a study published just last week in the Annals of Internal Medicine looking at patients who were hospitalized to 38 different hospitals with COVID and looking at mortality rates, looking at how many required ICU stays and how many people, how long they were in the hospital and how many people were rehospitalized and when were people able to return to work. And I'm quite proud that here in McLennan County and in Waco, we have numbers and percentages that look much better than this report. But I do want to read some of those numbers and then maybe contrast them with some of our own, just as kind of a celebratory note but also as a reminder that this is still a real thing. So of these patients who were hospitalized to 38 hospitals, they found that the mortality rate of hospitalized patients exceeded 29%, which is very high. That's, again, 1 in 4 patients. Actually, it's more than 1 in 4. Here in McLennan County, our mortality rate for hospitalized patients is less than 15%. So still very high, but much better. And then another number, which I found very interesting, was looking at patients who were rehospitalized within 60 days, and that number exceeded 15%. We're seeing numbers that are single digits. And then one more number, which is perhaps not talked about very much, which is when people get this illness, what does it do to them? How does it affect them besides, of course, taking lives? We focus on those mortality numbers because that's so final and so drastic. But of patients who were hospitalized after 60 days, 40% of them still had been unable to return to work. So that's a huge, huge problem for loss of income, financial stability of our community, and then also financial stability of families. So very big deal. I have lost track this week of how many people have contacted me, whether these are friends, family members, or family members or friends who have contracted COVID, and wondering what can I do now that I'm sick and when should I be worried? And I want to just kind of mention a few of those comments really quickly. Those first 7 days of illness are going to be somewhat varied, but they're still typical. And that's going to be the flu-like symptoms, whether you have fever, cough, loss of appetite, loss of energy, body aches, loss of taste and smell, and the cough. And there's a few more, but those are some of the big ones. And some people have mild symptoms and some people will be rather severe. But those are the pretty typical symptoms. And most people will be sick for those 7 days and get better. It's those next 7 days where people start to get chest pain, worsening cough, shortness of breath that doesn't resolve with rest. And particularly when you're getting up and walking around and exerting yourself, you get very short of breath. That's when we need to be really worried about you. And that's when you need to get checked out if you haven't already been checked out. So it's that shortness of breath that doesn't resolve. And if you have a cough that just won't go away, it can be incredibly painful and you can strain muscles. So if you'll just take a big pillow and bear hug it as you're coughing, that can help resolve some of those coughing spells and some of that pain. And then, of course, if you're having that really tough cough and shortness of breath, lying on your chest can also be helpful. And then if you've had COVID, what can you do? We really need you to donate plasma. Our blood bank has been running short, especially on B and AB blood types this last week. And we had several patients who just were not able to get plasma or plasma in a timely fashion. And plasma, to remind you, is perhaps the most effective therapy that we have for critically ill patients and moderately ill patients with COVID-19. I'll wrap up my comments there for now, but again, want to wish you a happy Thanksgiving and please be safe.
Thank you, Dr. Elyson. Let's go to Dr. Brian Becker with Ascension Providence. Dr. Becker?
Thank you, Larry. I'd like to wish everyone a happy Thanksgiving. I hope you enjoy an opportunity to safely interact with family and friends and take some time to reflect on all that we do have to be thankful for from the past year, and encourage folks to celebrate the holiday, but do so responsibly. At Ascension Providence, we continue to see a steady increase in the number of hospitalized COVID-19 patients. We've averaged in the low 50s over the last 7 days. So that's up from what was 40 and 30 in the weeks before. We are working on plans at the present time to begin to administer COVID-19 vaccines as they become available across our associates and our medical staff, which will be a first level of vaccination. So trying to work on those plans at the present time. We do currently have adequate supplies. We have adequate medications and personal protective equipment. And we continue to streamline our processes and patient flow to ensure the safety of our patients and our staff. And again, as has been said, I just think it's important that we continue to remember to wear our masks, socially distance, and practice hand hygiene. And most importantly, stay home and don't interact in the public if you don't feel well. So I'll keep it brief and look forward to questions, Larry. Thank you.
Thank you. Judge Scott Felton, McLennan County Judge Scott Felton. Judge?
Good afternoon, everyone. And I also want to wish everyone a happy Thanksgiving. I know there's a lot of modifications that are taking place in many families to be able to accommodate the best we can out of Thanksgiving. More than likely, it will not be traditional. We are seeing in the county, within the county employee group, all the way from the county jail through the tax office, DA's office, and all, a lot of disruption due to COVID-19, and then all the contact tracing that affects people that maybe aren't sick but were in close proximity to those. And so if you're trying to do business with us and we have little problems, we apologize. We hope we can get this straightened out before long. We are encouraging our employees to test if they think they've have been in an area that might have exposed them, which could be at work or it could be at the grocery store or other places. Testing is so easy now. Yesterday, I went by MCC to the walk-up facility. It took me exactly 6 minutes to get out of my vehicle, walk over, register, pre-registered, and then gave them the saliva sample and turned around and was gone. And so it's easy. And so I recommend that if you feel like you need to have one or just don't know and need to know, I encourage you to be tested. We are told by these medical professionals that, as Dr. Griggs showed a while ago, that you may have COVID and not know it for many days. And if you knew it ahead of time, there's all that group of people that you would expose yourself to that you could have prevented that from happening. So just one other thing, I am proud to say that working with a fine group of folks here, and if you saw Waco today, it recognized Dr. Jackson Griggs for his service to our community and helping get out information to the public through many ways, but including but not limited to what we're doing here today. And he'll be the first to tell you that there's a whole group of people out there that that should get credit to, and I give them credit. But he provides great leadership, and I want to thank you for that publicly. Also mentioned in that was Mayor Deaver, who was a great communicator through his term and provided, he did yeoman service. The taxpayers got their money's worth with Mayor Deaver, I can tell you that, and we're going to try to get that out of Dillon Meek, and I think we will. he's very passionate about this and wants to do the best job we can do in communicating around. And that's all I have, and be ready to answer any questions that might come up.
Okay, thanks, Judge. I appreciate it. Now let's go to our new mayor, Waco Mayor Dylan Meade. Dylan?
Thank you, Judge, for those kind words. I hope to live up to it. And again, I echo those congratulations to Jackson on that well-deserved honor, and to the rest of our frontline workers in our medical community. This is the week of Thanksgiving, a time that we as Americans traditionally give pause to give thanks for the blessings in our lives. And in what has proven to be a difficult year, I've found strength in giving thanks to God for the blessings and the goodness that does exist, even in good times. For me, I'm thankful for the joys in my life, like my family and my growing kiddos, and the good neighbors that I have. I'm also thankful for the teachers, the educators, those who are teaching children online and in the classroom. To them, thank you. I'm thankful for our small business community, our small business owners and their customers and clients who have pulled together to keep the economy moving forward. Thank you. I'm thankful for the doctors, the nurses, the healthcare providers, and our frontline workers, including those on this call, who are working tirelessly to keep our community safe and healthy. Thank you. I'm thankful for our nonprofits and our churches and communities of faith who have selflessly served those around them. Thank you. I'm thankful for our government employees working around the clock to monitor data, staff the local and free testing sites, convene planning around hospital capacity and vaccinations. Thank you. I'm thankful to the folks, like I said, the folks on this call as well. Sometimes it's in the hard and broken places that we can identify what we do have in our lives that we can be thankful for. This has been a hard time, but this week of Thanksgiving, I'm thankful for the goodness of good people here in Waco and the promise we have of brighter days ahead. I'm going to skip over the data. I know I sent my PowerPoint over to Julie, but for sake of time, we don't have to throw that up there because I think Jackson or Dr. Griggs covered most of that. But a couple things that I just want to point out without even putting that up there is we had an average of 180 cases per day this week. That's significantly higher than what we've seen recently, and our numbers and our trends are significantly rising on that. And not surprising is kind of a lagging data set, which is the number of hospitalizations. Today, we have 94 people hospitalized. This compares to 69 when we gave this press conference 1 week ago. And so I think it is, that's a big jump. That's a big increase. And while I am thankful for our hospitals who have good news to report in terms of capacity, that is not guaranteed or assured. Another significant and very sad number is the 15 deaths that have occurred this week due to this virus. This compares to 5 deaths reported at this time last week. So 15 additional total deaths this week. And as Dr. Griggs mentioned, that brings our number on that stat to 185. So for the sake of those in the community that have higher risk of severe illness and death from this virus, whether family members that we care for, to our coworkers, to just those we pass in the grocery store, we must continue to exercise caution. We live in a country that believes strongly in our right to make our own decisions, and I certainly believe that too. But we must recognize that the decisions we make can affect others. We have a part to play in keeping one another safe. And we must continue to remember that we can carry and transmit this virus without experiencing symptoms or knowing that we have been exposed to it. So as you make your Thanksgiving plans, please carefully consider all the risk to the people that you care about, especially those most vulnerable to serious illness and death. As a reminder, at the present time, Texas mayors and local governments have almost no policymaking authority. Governor Abbott has implemented and has control of all of the regulations and mandates, from mask wearing to different types of business closures. Right now, the hospitalization rates continue to climb, as I mentioned. And as that happens, our hospital systems, our city staff, our county judge, and myself are in close, regular contact with each other as we discuss, monitor data, and look at hospital capacity and personnel. I'm thankful for our hospitals in our region and their good and hard work, and our hospitals and the Waco McLennan County Office of Emergency Management have developed robust plans to keep the population safe should the number of hospital patients increase to a degree of serious alarm. As has been mentioned, data shows that that as the virus spreads, hospitalization rates increase. It is true that our hospitals have dramatically increased their capacity and we're in good shape today, but that is not unlimited. But this is a time for hope. More positive news comes out daily regarding vaccines, and Waco is already at work to ensure that we're prepared for local vaccinations. Our local Office of Emergency Management has been doing much work around this already to learn about vaccines and make plans for the distribution of these vaccines. One thing that is occurring now is the Office of Emergency Management is assembling a vaccination planning coalition that will include healthcare providers and entities that are registered to be COVID-19 vaccine providers, jurisdictions with critical infrastructure personnel and first responders like fire and law enforcement, EMS, and congregate care settings, including long-term care facilities, jails, etc. This coalition will work to ensure that there are enough appropriate vaccine providers enrolled, discuss logistical needs of enrolled providers, establish understanding among priority vaccine candidates regarding who will be vaccinated, what priority and uptake estimates are, where they will be vaccinated, and advocate for just access and distribution. So that's exciting news. And I think the promise of that day is definitely what we need in this time. In the last 8 months, we have learned so much about how to take precautions against this virus. Smart and safe behavior allows us to go about our lives without fear. And I encourage us to exercise wisdom in the days ahead. My prayers are for our city, and my confidence is that good days are ahead of us. And this week, I'm thankful for that. So that's all the comments I have today, Larry.
Okay, thank you. Actually, I go to the questions now, but the first question is pretty much like you all have talked about, is what advice do the doctors have regarding Thanksgiving? Anybody have anything extra to add to that one, or I'll move on to the next question? Thanksgiving is an important time. So the next one actually is, if I travel for Thanksgiving, do I need to quarantine when I return?
Dr. Griggs, do you want to take that one?
Absolutely. So this is a really important question, but at the heart of the question is who should quarantine, not just for travel, but given the very high prevalence of a contagious, potentially life-threatening virus in our community right now, who should quarantine? And while travel can certainly increase our community's chances of growing case numbers and individuals' risk of COVID-19, it's really not the sum total of the story. And given the very high risk of prevalence in our own community, any unmasked close contact with those outside of the household poses risk of catching the virus. So not just travel, but really any risky health behaviors within our community puts not just the individuals at risk, but also the rest of the community. So I think during the holidays and during this surge, quarantining for 14 days is appropriate, not just for travel, after travel, when there's lax health behaviors, but really within our own community, if there are lax health behaviors or exposures to high-risk events. So I guess I'm just making the point that while travel quarantining after risky behaviors during travel is important. Right now, given the high prevalence, even having a big Thanksgiving dinner with indoors with 12 or 13 or 14 other members from outside the household, it would put the individual and the community at such risk that, in my own opinion, quarantine would be appropriate for the whole group. If our numbers weren't so high, I might opine differently, but given the very high prevalence right now, these high-risk events are concerning to the point that I think that we would need to quarantine after events such as that.
Okay, let's go to hospitalization rates. They continue to climb. What are concerns over capacity of both physical space and personnel at the hospitals?
I'm going to give this to Dr. Becker and Dr. Eliason, but first I did want to comment that our public health staff and emergency operations staff are working with Hot Rack in both hospitals on a daily basis to monitor space capacity, have standing plans for additional capacity in the unlikely event that need arises. I do think that Dr. Becker and Dr. Eliason are probably equipped to answer this as well. So Dr. Eliason, do you want to kick us off?
Yeah, sure. So we currently have capacity, and this is an issue that is concerning to us, and it's something that we are assessing several times a day, looking at our current space, our current staffing. We have ventilator capacity, but as you said, Mayor, that space is limited to a point. But we do have plans in place if we have to overflow out of the hospital. But for right now and for the foreseeable future, we are prepared to take this on.
And I would add, all the way back in March, both systems developed surge plans. And what would that look like as we began to outpace our normal capacity? I'm happy to say at the present time, we're functioning inside of what's normal for us. So we haven't begun to expand into spaces that would not typically be looked at as patient rooms or areas that we would normally house a patient. So while we are busy and we have a large volume of patients, we certainly have capacity to see more and more folks. And I would agree with Dr. Eliason. We have ventilator capacity that's not tapped yet. So I think we're in a pretty good position for today. But it is worrisome to look at the trend we've seen over the last month.
This next question is actually kind of on the same subject, but a little further into it. Should local citizens be concerned that any patient needing critical care, either COVID or something else, that they'll ever be turned away from the hospital because of capacity, like you just talked about? Is that a concern?
Dr. Becker, Dr. Eliason, either
Yeah,
one.
it's not a concern today. That could become a concern in the future, but today, this week, it's not an issue.
Okay.
And I would say the same.
Okay, good. What's being done to prepare for vaccines locally?
Sure, I hit on that a bit
You did,
in
yeah.
my initial comments. The health response team has been working together since early in the pandemic and will continue to work with a coalition of healthcare providers who have registered to be COVID-19 vaccine providers to ensure that we're prepared for this. The state is going to really dictate a lot of how this gets rolled out. But at the same time, there's going to be a lot of things that we can do, and that is come up with good infrastructure plans, good distribution plans, security protocol, ensure that we have a plan to distribute per state and federal guidelines, which will probably have a prioritization schedule. And so I'm pleased to report that the Office of Emergency Management is leading out smart and wisely on this and coalescing, I think, the right people in the community, the right stakeholders in the community to ensure that we do this well. But I would like to see if any of the doctors on the call or Judge Felton had anything to add to that.
I would agree with everything you've said. I really appreciate particularly Stephanie Alvey at the Health District and her leadership in this work. At the state level, if anyone is kind of interested in getting into the thoughts from the Department of State Health Services, you can look online on the DSHS website. You can search for Texas COVID-19 vaccine allocation guiding principles. And they provide definitions and details about the first phase of vaccine allocation if you're interested in what the state is thinking.
Okay, I'm going to move on. Over the past weeks, we've seen our COVID hospitalization rate top the 15% trigger twice, but not on 7 consecutive days. Can you remind us about the meaning of the governor's order and the possible results?
Judge Felton, do you want to field this question?
Yeah, I sure will. You may recall the guideline was set that if we exceed 15% of capacity of the hospitals with COVID patients, that we would, and it'd have to be 7 days, consecutive days with no breaks in it. At that point, the bars would be closed. The order to allow bars to open would be pulled back. Restaurants would go to from 75% capacity to 50% capacity. And businesses would have the same regulations as far as capacity in their facility. Now, if it turned around and it was below 15% after that for 7 consecutive days, then the orders could go back to the larger capacity. So the trend that we're going, that we're looking at right now looks like there's a really high chance that we're going to exceed that 15% for 7 days, especially with the holidays coming up, where there's seems to be a certain amount of surges after big events like national holidays. So, but we will keep the community informed of that.
All right. Have our hospitals been taking patients from other regions or from outside our trauma service area?
Dr. Becker, Dr. Eliason, do you want to take this one?
I checked on the data on this a little bit earlier today, and we continue to have some patients that are transferred into us that are not technically in our region, but they are still hospitals that we partner with on a regular basis and accept transfers for services not provided in those facilities. We've not had a COVID patient transferred in from afar, from El Paso or somewhere else across the state in our facility. We have been working as an Ascension market. The positivity rate in Austin is certainly far below what we see in our area. And so our Seton sister Ascension facilities in Austin have been absorbing most of those transfer requests that we get, so as to keep our facility with an ability to manage our patients here locally.
Yeah, and so we have received a COVID patient from outside of our community, outside of our service area, but it is an issue that we are taking seriously, that we want to be able to provide services to people who need it, whether they're part of our community or not. But we are evaluating that on a daily basis as well as to whether we can take patients, COVID or non-COVID patients, based upon our current capacity. And right now we have capacity.
Okay, I'm going to combine a couple of questions right here and let it be the last one. So, but it's kind of more to the hospitalization part of it. How's the PPE supply holding up at both hospitals, and how are the hospital staff holding up?
Dr. Eliason, you want to start us off, and then Dr. Becker, you can close it down.
Yeah, so on PPE, we're doing really well. Several months into it, we took all of our disposable PPE and set it aside for a rainy day. And we are using some of that in our emergency department, but we are stockpiling that for later. And we are using reusable, washable PPE gowns specifically. And then as far as the masks and those kinds of things, gloves, that's all readily available. So we're really good on that aspect. And then as far as staffing is concerned, we do have staffing. It is tight, particularly as people get sick and need time to recover. Fortunately, there hasn't been a lot of that, but there has been some. And then, you know, as staffing gets tight, then we can pull to outside agencies that can supply nursing staff or others to help.
Dr. Becker, do you have a response on those? On your PPE?
I do. As I mentioned in my opening statement, we have adequate PPE at the present time. We certainly, over the course of the last 8 months, have transitioned in what we use, and we are working with what's available. But we do have adequate PPE for sure. And then staff, I think staff, just like the rest of the community, is growing weary. So they're taking care of folks who are sick, and that can be frustrating. The ability to interact with these patients is pretty limited, so as to keep our associates safe and to limit potential spread. So it is a taxing job, and I would tell you that our nursing staff, first and foremost, but it goes across the hospital to our physicians and to our nutrition services and our EVS folks. It is house-wide. Everyone is a little bit weary, and so I think, as we've said on a number of occasions before, if you run into one of these folks who is providing the service, give them a big thank you. They have been working long and hard for many months now to keep our community well and to provide these healthcare services to them. So tell them thank you.
All right. All right, we'll stop our questioning here. Let's go to the two media representatives we have online. We have Drake Lawson from KWTX News 10, and we have Rhiannon Sagert from the Waco Tribune Herald. And we'll go to Drake first for a question. Drake, are you on the line?
Yeah, Larry, can you hear me okay?
Sure do. Go right ahead with your question.
Okay, yeah, I just wanted to iron out maybe some of the details that was just talked about by Dr. Eliason and Dr. Becker. I know, Dr. Becker, you said there's no patients coming in from like the El Paso region or other areas of Texas at Providence. Dr. Eliason, you said that there is a patient. How many people are coming in outside of Central Texas into Hillcrest?
Yeah, at this time, we've only received one from El Paso, but we do remain open and willing to assess requests on a case-by-case basis. So it's something that certainly is available should they need it and we have capacity.
Dr. Becker, you want to respond to that same question?
I can. So as I said, we have not taken a patient from regions outside of our immediate area, and we have been working with our other Ascension hospitals who have a less of a load of COVID patients and more of a capacity to manage those folks, and that's been running through our incident command center for the state.
Okay, Drake, we'll be back to you in a moment. Rhiannon Sagert from the Waco Tribune Herald, do you have a question for us?
Yes. You mentioned if hospital staff become depleted, we could hire from other agencies, but won't other hospitals do the same? And how much of a supply is there from that source of workers?
Dr. Becker, do you want to start off with that? And then Dr. Eliason, if you want to have any addition.
Sure. So agency nursing or traveler nurses have been around forever, and it's a locums kind of opportunity for nurses who would like to work in different areas across the country. So your point is well taken. There are a number of needs across our country, and that is a limited resource as well. So it does afford the ability to bring in some temporary nursing assistants. They typically sign up for several weeks to a month or two at a time. And it is a resource that we, much like Hillcrest has tapped into. We have some starting next week. And it just provides a bit of relief. It fills some gaps that we may have and gives our permanent staff a bit of a reprieve from what they are doing day to day.
Yeah, and I'll just tack onto that, very similar comment, but even before the advent of COVID, agency nursing has been something that hospitals, including Baylor Scott and White Hillcrest, have used from time to time for eons. And so we've had periods where we haven't needed them, and we've had periods where we've had to use them. We currently have a very small number of agency nurses on staff at our hospital presently. Yes, I'm sure the supply is limited, but it is a resource that is out there and that we can, quote unquote, tap into.
Okay, Rihanna, we'll be back to you in a moment. Drake, you have another question for us?
Yeah, I had one other question, kind of along similar lines of what we've been talking about. You mentioned it earlier, Dr. Eliason, with fatigue. People are feeling the fatigue with mask wearing, unfortunately. But for people working the front lines, I mean, Dr. Becker, you mentioned it, to tell them thank you. For those nurses, for those doctors, for everyone at the hospitals who are working those front lines, I'm sure there's a mighty bit of fatigue they're feeling as well. Is there programs that are set up for them, and how are they handling this as far as the day in, day out operations for their mental health right now?
Yeah, I can't speak for Ascension Providence, but at our facility, many years ago, we instituted a program called Swaddle, which is peers who have special training. So if you're a nurse and you're having a difficult time because of, let's say you've lost a patient and you feel really sad about it and you're having a hard time coping with that, there is a colleague, so an equivalent peer nurse, who's been trained to help with some counseling and help with that activity. Physicians and other staff in this program. And so that is widely published, widely available. It's free to all employees. And I think also, more than just that, also having a friend who you can talk to, who you can share your experiences, the good, the bad. And sometimes just talking through it can be incredibly helpful and cathartic and healing.
Okay.
We have a similar program called PACT. It's Provider Associate Care Team, and it deals with more acute settings where an event occurred that was particularly upsetting to a caregiver. And so that is an immediate response that helps plug our associates into other resources. Our organization has a number of resources available for our associates and our medical staff that they can plug into for counseling or just an ear to listen. And then I would call attention, our McLennan County Medical Society has put together a program that is free to healthcare providers who are members of the McLennan County Medical Society. And it's fairly new. It's a month or two old now, maybe a bit more. And it is for counseling, if they so desire. They can call and they are plugged into a series of counseling sessions should they so desire. So kudos to our McLennan County Medical Society and the team that stood that up. It is a very useful tool in a time like this.
Rick, if I could just say one more thing, I think part of what makes this uniquely difficult, because we've always had deaths, we've always had illness, we've always had what you might call bad outcomes in certain cases. This is not a problem of physicians and nurses and respiratory therapists and other medical personnel having difficult moments in their career. But what is uniquely difficult about COVID is that it's so pervasive, it's so persistent, and when patients are hospitalized, they're not just hospitalized for a night. It's not like they check in with a suitcase and a change of clothes and they're going out in the morning. They're coming in and they're staying for 10 days, 2 weeks, sometimes a month. And there's always that nagging question in their mind and the family's mind, are they gonna make it out? Are they gonna survive? And as was said a moment ago too, our ability to interact with those patients is impaired. We're wearing PPE, which can be intimidating, and it can also prevent that extra communication, that nonverbal communication, facial expressions, intimate contact like a hug or and those kinds of things. And I don't feel like I need to rush in and out of a room. I do feel perfectly safe wearing my PPE and getting very close to patients so that they can hear me, because there are mask barriers. So I do have to get very close to patients, but still it's not the same. And we want to connect with patients. We want them to feel that we care about them and we want to make them better. But there's just that extra layer of anxiety, intensity, worry, concern. And then there are deaths. And especially after you've taken care of somebody for 3 weeks and you've seen them and you get to know their stories and you get to meet with their families and you're talking to their families on the phone every day when they can't be there, it becomes even more intense. And so that's, again, I just wanted to kind of let people know that why it's so real and why it's so difficult.
Okay, thank you, Drake, for your question. Rhiannon, we have one more question from you.
I just wanted to check something. The 96 who are hospitalized right now, is that the highest number of people who've been hospitalized so far?
I believe that's right. Dr. Becker, Dr. Eliason, do you know otherwise?
That's correct.
Right.
Okay. All right, thank you both, Drake and Rhiannon, for your questions. Now we're going to wrap up here and allow our mayor to make the closing comments for us. Mayor Meek, would you like to make some comments for us? And then we'll close.
We'll end quickly. I thank everyone for their time today. I thank the participants, this panel, for taking the time to be here to answer these important questions for our community. I'm going to echo what has been said, and that is just urging safe practices that that were iterated on this call. And with that, I am hopeful for a safe and happy Thanksgiving for our community.
Thank you, and thank all of you all for great information again. And from the City of Waco offices here, we wish all of you all a happy and a safe Thanksgiving as well, too. So I want to remind everybody that this afternoon at 4:30 there will be a complete Spanish replay of this in Spanish interpretation. And then at 7 o'clock tonight, anybody in your family or your friends that would like to see this, they can watch it live, or they can go to our website anytime and watch it on demand. So that's what one thing has not been mentioned a whole lot, but we'll always remind, the doctors always say to remind everybody to get their flu shot. Flu shots are very critical this year. That's very easy. You can get them at most pharmacies, drugstores, or grocery stores. Get your flu shots and take care of that. And we hope that everybody has a whole wonderful, safe Thanksgiving. And we'll be back next week, same time, same place. Thank you very much for joining us. Have a good day.